Hello, my name is Keisha Griffith, Clinical Manager for UNC Rex 6 West at UNC Rex Healthcare. Thank you for joining us for the total knee replacement preoperative joint class. Thank you for attending the UNC Rex joint replacement class today. This presentation is designed to prepare you for your upcoming surgery and your stay in the hospital. Joint replacements at Rex have now resulted in a shorter hospital stay. Many patients are able to go home the day after surgery. The expected length of stay for our patients here at Rex is 1 to 2 days. Most patients will be walking within hours of surgery. We perform over 2,000 elective total joint replacements each year. So what should you bring for your stay? Clothing that is comfortable, loose fitting, loose leg pants with either an elastic waistband or drawstring. We provide non-skid socks. Shoes should be supportive with closed heel. You need to avoid flip-flops or bedroom slippers as they can lead to accidents in the hospital such as falls. Personal hygiene products and undergarments. Assistive devices are glasses, hearing aids, dentures, CPAP, walker. Label your containers or belongings. If you choose to bring your walker, you may decide to leave your walker in the car until it is time for you to discharge. We will have a walker available for you during your hospital stay. A copy of your advance directives such as living will, healthcare power of attorney. What not to bring to the hospital is unnecessary valuables, jewelry, wallets, purses. Do not bring home medications. Medications from home will only be allowed by physician order in cases where the hospital pharmacy cannot provide the medication or a suitable substitute. You will not need to bring your insurance card as this will be collected during pre-op. You will need ID, however, if you decide to get your medications filled prior to being discharged. On the day of surgery, you will go to registration, which is located at the main entrance on the right. On the day of surgery, you will go to pre-op, where you will be prepared for your procedure. You will have an IV started. They may most likely initiate antibiotics, and then you will proceed to your surgery, which will last 1 to 2 hours. Your family should be in the surgical waiting room, as this is where the surgeon will visit your family and caregiver and provide an update as to the progress of your surgical procedure or how things went and what steps need to be taken going forward. On the day of surgery, after your procedure is complete, you will go to the recovery room where you will spend at least 1 hour in recovery. This time may be up to 2 to 3 hours depending on the circumstances. Each patient recovers differently. Once your room is ready on the orthopedic unit, staff members may send your family or caregiver to your assigned room to wait for you. Once you arrive to your room on the 6th floor, which is the orthopedic unit in the patient tower, you will have a private room with a walk-in shower, elevated commode seat, closet, recliner, TV, phone, and also a bedside call bell. On arrival to your room, your nurse and your nursing assistant will greet you. They will take your vital signs, complete a head-to-toe assessment, a pain assessment, ask admission questions, and discuss the plan of care. Your nurse will review your care folder with you. Inside the care folder will be valuable information that will help you plan for your discharge. They will need about 10 minutes to settle you, and they may ask for privacy from family or friends while doing so. Visitation is important, and your family and primary caregivers are encouraged to be present. Caregivers and family are welcome to visit, and they are encouraged to be a part of therapy sessions if possible. Your caregiver or the person that is going to take you home should be at the hospital the morning of your discharge to be involved in the discharge process. 8 a.m. is usually a good time for them to be at the hospital. It is important to plan to have someone to assist you at home for at least the first 48 hours around the clock. We do have Rex room service here available, and this starts off with a light meal because you've had surgery. You are more prone to nausea and vomiting, which is common after anesthesia. Room service ordering is available between 6:45 a.m. and 6:45 p.m. Meals typically take about an hour, plus or minus a few minutes to arrive to your room. Rounding will be done by the surgeon, the nursing staff, and nursing assistants after your surgery. You will be visited frequently during the hours so that we can make sure that you are not experiencing any of the post-op complications that we will discuss shortly. Your surgeon or their PA will see you each day you are in the hospital. They do arrive early, typically between 5:30 and 7 o'clock a.m. So if you have questions or concerns that you would like to share with your provider, please make sure that you are ready to do so between 5:30 and 7 a.m. This is the best time to address questions or concerns. UNC Rex is a tobacco-free facility. There's no smoking, chewing, or vapor. Patients who use tobacco are at increased risk for complications after knee replacement. One of the post-op complications that we focus on preventing is pneumonia. Pneumonia can be a complication after surgery. An incentive spirometer is used to help prevent post-op pneumonia. Nursing staff will provide you with instructions for use on arrival to your room. You will be encouraged to use it hourly while awake. We also focus on preventing blood clots. You will be at risk for developing a blood clot after your surgery. Your doctor has likely discussed the need for taking a blood thinner after your surgery. It may start the day of surgery or the day after. It is important that you continue to take your blood thinner as prescribed. Your nurse will review specifics about side effects with you. Most common is easy bruising and minor bleeding. Preventing blood clots is important. As previously stated, blood circulation is extremely important in this process. Walking and PT exercises. Flexi-posts are foot pumps. These are soft wraps that are placed around your feet. It helps prevent a deep vein thrombosis, or in other words, blood clot. Preventing infection is another focus after surgery. Hand washing can help prevent infection in patients, visitors, and staff. You will receive antibiotics through your IV during your hospital stay. Many surgeons recommend preventative antibiotics prior to dental work for life. Your safety is important to us. You will be at risk for falling because of your surgery, pain medications, IV lines, being in a different environment. Anytime you feel like you need to get out of bed for any reason, please call for assistance and wait for a staff member to assist you. You will see signs up in your room with the acronym called Don't Fall. Preventing constipation is another post-op complication that we focus on. Side effects of medications and decreased physical activity may cause constipation. Stool softeners will be ordered for you after surgery, and you will also continue to take stool softeners upon discharge. Drink plenty of fluids, even in the days leading up to surgery. Walking is important to help stimulate your bowels after surgery. We want you to be proactive. Many of the things discussed here are things that you can begin doing prior to your surgery. Most patients will not have a urinary catheter. Anytime you need to use the bathroom, call and wait for a staff member to assist you to the bedside commode or toilet. And please remember, we want you to call, don't fall. You will have a large dressing placed on your knee immediately after surgery. It will be removed on the morning after surgery or the following day and replaced with a smaller dressing. Before leaving the hospital, your nurse will give you instructions about your dressing and wound care. Pain is expected after knee replacement. Your surgeon may order several different medications that work in different ways to help you with pain. This can include scheduled Tylenol, anti-inflammatories, or medication to help with muscle spasms. The nursing staff will offer repositioning, elevating your leg, ice packs, and even walking to help manage your pain. Your nurse will frequently ask you to rate your pain from 0 to 10. 0 meaning no pain, 10 is the worst pain you can imagine, and we want you to have a realistic goal in mind, such as a 4. It is our goal to help you control your pain. We may not be able to take all the pain away. Please ask for pain medicine when you need it. Please share concerns, questions, preferences with your nurse, and remember that communication is the key. We do have an outpatient pharmacy that is available to fill prescriptions for you at the time of discharge. You will most likely have new prescriptions to take home with you after surgery, such as pain medicine or blood thinner. You are welcome to have them filled at our pharmacy. Medicines will be delivered to your hospital room and payment is accepted at that time. Please remember that if you have your meds filled here at Rex, that you or your family member will need to have their ID upon delivery of the medications. I will now turn it over to Brittany Reynolds, who is the manager of rehab services, to speak to you about rehabilitation.
Thank you, Keisha. My name is Brittany, and I'm one of the occupational therapists here at Rex. You will see both physical therapy and occupational therapy during your stay. Physical therapy will come in on the day of your surgery and the day after your surgery, and occupational therapy will come in most likely on the day after your surgery before you discharge. Therapy is a critical part of the recovery process to increase your strength and endurance. To help you prepare, please try to remain as active as possible prior to your surgery to maintain your strength and endurance. Please review the home safety preparation checklist to help prepare you and your home to be safe and independent after surgery. Prior to coming to the hospital on the day of your surgery, please count how many steps you have and where your handrails are located for any area of the home that you may have to access, including steps to get into your home and to any other level of the home. Physical therapy. Your physical therapist will teach you how to get in and out of bed, how to walk with a walker or other device, how to perform your home exercise program, and how to walk up and down your stairs. Occupational therapy. Your occupational therapist will teach you how to get on and off the toilet and manage your hygiene, provide you tips for getting dressed, give you techniques for getting in and out of the shower or bathtub, and help with home setup for safety and increased independence with your daily tasks at home. I will now turn it over to one of our case managers, Melissa.
Thank you, Brittany. My name is Melissa. I'm one of the social workers here at the Case Management Department at Rex, and I'll be going over the role of case management within this process. Your case manager at the hospital will help to coordinate and set up discharge plans for you. We're here to help get you any equipment that you need. That includes ordering your equipment and having it delivered to your room prior to your discharge home. We're also here to help coordinate any home health needs at discharge if recommended. Based on the surgeon's preference, we'll be helping to coordinate those things for you, and also coordinating and confirming your start of care at home if you need home health. We're here to communicate your discharge plans with your care team. That includes discussing any concerns, questions, or updates in regards to your discharge plan. Please make sure you have arranged for someone to stay with you at home for at least the first 2 to 3 days around the clock. Your social worker and case manager will also be here to help remind you about these arrangements, because we're here to also help encourage that you have a safe discharge home. Equipment. Knee replacement patients will need a rolling walker and possibly a 3-in-1 commode at discharge. Below are illustrations of a rolling walker and a 3-in-1 bedside commode. The rolling walker, I just want to point out that you may have a rollator at home, and a rolling walker is different. So if you need a rolling walker, we'll order that for you. And just wanted to point out that beside that, the bedside commode, it's named for its purpose. It's a 3-in-1. You can use it as a bedside commode next to your bed, for a shower chair, or for an orbital toilet seat that's elevated. Your equipment will be delivered to your room at the hospital before you leave, unless you already own one. But if you need new equipment, we'll help get that ordered for you. The cost of equipment may be covered by insurance. And I want to stress the word may, because we cannot guarantee that your insurance will cover the full cost of any equipment. That is based on your insurance plan and your deductible and other items. And more information on equipment and insurance, frequently asked questions will be provided on the frequently asked questions page that you'll have access to. Therapy after the hospital. Each patient and surgeon will discuss a discharge plan. You'll see your surgeon or your PA every day, and we stress, as indicated earlier, to discuss any questions or concerns you may have about your discharge plan or equipment or recommendations for post-care after the hospital. So please feel comfortable to ask questions when your surgeon or PA comes to see you early in the morning. Most patients start out with outpatient physical therapy. Most patients do too well to need to have rehab after surgery and after the hospital. But if you are recommended for that, your case manager will help to coordinate those needs, and you'll be involved in the process every step of the way. This also includes, as mentioned, any home health or any referrals that you'll need from the surgeon based on their recommendations. Your case manager is here to help you coordinate all of that. You will need to call the therapy location to schedule your appointments. So please schedule your appointments in advance. Your case manager will also be here to remind you about setting your appointments and confirming them before you leave the hospital. Ongoing activity. Please avoid high-impact activities. Maintain regular exercise, including walking, aquatics, and biking. Also, maintain a healthy weight. And I'm going to turn it back over to Keisha to discuss a few more topics.
So the last thing we want to mention is privacy. As excited as you are to see your loved one out of bed the day of surgery, please do not take photos or videos of Rex staff members or other patients. Our orthopedic staff will provide you with excellent care while recovering from your surgery. Thank you so much for attending this educational session for our total knee replacement program here at UNC Rex. Questions or concerns, if you have questions, please refer to the frequently asked questions on this website. If your question remains unanswered or if you have additional concerns, please contact us via email at rexjointclass@unchealth.unc.edu or via phone at 919-784-2082. Once again, thank you for attending this educational session, and we look forward to caring for you.